So now we're going to imagine that the patient who had only low back pain is coming back in after they've gotten their MRI. Our MA put in the MRI or the diagnostic order for an MRI. They already had it, and now they're coming back in for an appointment to go over the MRI with Dr. Howe. It'll usually be labeled as a follow-up diagnostic. And so the way that we get this note to come back here is by hitting copy forward. And so it doesn't, and then so there is this chart note here, and that's the most recent chart note with Dr. Howe. And so you want to copy the most recent chart note content with Dr. Howe over. And so we've already done that here. He'll remove the done when he's done signing off on it. So that's where it went from before. Anyways, so now this is what we have, and the patient is coming back to follow up on their MRI. And because we've seen this patient before, and we've given him kind of like a, like a diagnosis of what he has, we're going to change this to history of. And you'll see that if you go into my phrases and you input a follow-up MRI. And this will give you a template of what lines need to be included for patients who are coming in after their MRI. So I just change it, but you can also just add in the phrase and then fill it out from there so you know all the lines that you need to include. So I know that they're a 50-year-old male, 54-year-old male with history of whatever's down here, lumbar axial pain. That was their condition that they were diagnosed with. The patient returns today for follow-up reporting. So if the patient says, you know what, the Voltaren gel really did help me, but I'm still feeling some pain, so I want to see, what this MRI is going to say. You can say partial improvement, the symptoms, or you can say significant improvement to the symptoms if it feels like, the patient doesn't really need any further treatment besides that one medication that was prescribed to them. But a lot of times patients will come in and say nothing's really changed, their pain is still severe, and so you would just say the patient returns today for follow-up reporting no change to the symptoms since the last visit. And then this part's easy because everything from the HPI that you had earlier, you can kind of just copy and paste it in. And so you can copy and paste it all from here, and then let's do this. Pain across the lower lumbar region. Then I'll just say has continued, because from the first appointment we knew it was located, and now we would just want to say, did it get better? Did it continue? Did it get worse? But the pain across the lower lumbar region has just continued. And we can leave the rest of it the same. And so earlier and now they're taking ibuprofen, but they're also applying Voltaren gel. And let's just say he's doing it as needed with. You can kind of just change this part based on whatever they say, or how much it's helping. If it's significant relief, then that's great. And then I'm just going to delete the rest of this because we filled out all of it. And I'll make a new line for saying, sorry, not yet. And then the physical exam is still going to be positive for exacerbation of pain. They still have symptoms. But now what's going to happen is that in the imaging, the patient will have an MRI done. And so X-ray reads are kind of just placeholders for MRIs. So if they have an old MRI that's more than 2 years old, oftentimes we'll get new X-rays because that new X-ray will be the placeholder for the new updated MRI. And so in this case, they only had an X-ray. And so every time we get an MRI that's newer than an X-ray, we'll replace whatever X-ray happened before the MRI with the new MRI report. And so I'm just going to literally delete this. And then I will say they got an lumbar MRI. I can fill in the date. And so let's just say they got their MRI on 08/02/2024. And then now kind of the hard part is there will be something that says lumbar spine MRI. I'll go find one. For example, for this patient, they had their lumbar spine MRI done on the 16th. And so it'll have the impression. I could really quickly read the impression and think, okay, well, it talks about L4, L5 being kind of in the worst state. And so we'll probably treat L4, L5. If not, though, there might be other findings that the radiologist didn't put in the impression, or the impression might say something like this alone, like the level by level degenerative changes as described below. It's not very helpful. And so usually what we'll do is read starting by the level by level, saying like T9, T10, all the way through to like the end, which is L5S1. I'll take my phone and open the photo app. I have an iPhone, so then when I focus it on text, a text icon will pop up on the bottom right, and when I click it, it makes the image of text selectable. I'll copy that text, put it into a Google Doc on my phone, paste it there, and then on my laptop or monitor screen, I minimize next, go into the same doc that's opened on my laptop, and then copy and paste the content here. And then I go back into NextGen, and then I can paste whatever I had copied. Of follow-up MRIs, this part is typically what takes the longest, the pasting in the MRI report. If you find that it's taking you too long to do in the middle of an appointment, that's fine. The MRI report is always there, and even at the end of clinic, you can go back in and paste them. What's more important is to listen to how the patient is doing, because that's not necessarily information that you can get back once the appointment is done. And then this is still the same. We fix the imaging, and now to go here. And so we can remove number 2 and replace it with whatever the issue is. And so if I'm reading, if I know that if Dr. House is talking about the issue being L4, L5, for example, in this MRI read, I'm going to copy and paste this part with the central, that has to do with central canal stenosis and neuroforaminal narrowing. Because that is what causes symptoms of whether it's lumbar axial pain or any like nerve radiating pain. And so because this patient is only having low back pain, probably likely to secondary to facet joint arthrosis at L4-5, even though they have neuroforaminal narrowing or central canal stenosis, it's not causing nerve pain. So I'm going to call it asymptomatic mild central canal stenosis and mild right and mild to moderate left side, and then it's not left neuroforaminal narrowing. And then you can keep the anterolisthesis because that is important too. So now we fix the assessment, and then we can say the patient has an ongoing history of lumbar axial pain which has not responded to conservative care. And then now that we have this information, usually what will happen is Dr. Howe will suggest that the patient gets a cortisone injection to fix this issue. And so if they only have low back pain, what's recommended is a medial branch block, which will turn kind of like inject cortisone into the nerves of the facet joint, and kind of like at least alleviate the pain that you're experiencing from like the arthritis there. And so I'm going to go into lumbar MBB and just paste it. It's kind of long. So this patient only has an MRI in their imaging because we removed the x-ray because it was older than the MRI. If the x-ray is newer than the MRI, we'll keep say x-ray and MRI images, but the x-ray is older than the MRI. So we can just say I have independently interpreted MRI images. All of that stays. And then it's the bilateral L4-5 because that's the level and it's also on the both sides. 2 joints. Sometimes lumbar MBBs can be done on one joint as well. Like one level and one side as well. It doesn't have to be 2 different spots basically. And then he will be a candidate for radius ablation. And then for the will be continued, we'll fill it with the medication. Because he was prescribed Voltaren gel. Kind of just copy this part in here. that's how I change it if they have already been prescribed and they're just going to continue it. And then the last thing is, and so this entire chunk, I'm just going to Command X, and then I'm going to replace everything after the first sentence, because the first sentence is still talking about, what their condition is. And then we keep the end phrase, always. Save. And then that's everything. So if the patient says something like they don't want it right now, or they want to think about it, call back whenever they're ready, you can say consider injection. And then kind of like put it and replace it here. And then just say he will follow up with me as needed because, well, they're not going to have their procedure potentially. So if they change their mind or they want to talk about it after, they can follow up with Dr. Howe as needed. Otherwise, we just leave the template as is. There's other things that you can add. For example, if the patient was in severe pain and we gave them Toradol, we can say that given the severity of the symptoms, we give them Toradol. In that case, it would go before the medications, which is right before the Voltaren. Because, in this sentence, we're talking about how they're in such severe pain, and given this pain, we're giving them the injection. If that's the case, and we gave them Toradol, we would go into procedures and click the Toradol template, and then just fill this in if it was the right glute. We'll say that, and then also say that here. Okay. And so this is the patient's chart note. They're considering the injection, they got a Toradol, or they're considering the MDB, they got a Toradol injection, but we've reviewed the MRI with them. That's everything. I've marked it as done. I've also signed it off. So this chart note for follow-up MRI is all good to go.